Welcome to This Explainer. Look, if you're watching this, there's a really good chance that you or someone you love is facing a pretty overwhelming situation right now, seeking addiction treatment. It's a moment that's usually just filled with anxiety, urgency, and honestly, a ton of confusing information. But I want to completely flip your perspective right now. Instead of feeling like a vulnerable patient or a desperate family member, I want you to step into the role of a hiring manager. Seriously, you're about to hire a facility for literally one of the most important jobs imaginable: saving a life. Finding a good fit dramatically improves the odds of recovery, while a bad fit, well, that just wastes precious time and money. So, we're going to arm you with a clear, empowering toolkit so you can make the absolute best choice. Okay, let's dive into this. Here's our roadmap for today. We'll be hitting 1. Verifying credentials, 2. Matching needs, 3. Essential questions, 4. Spotting red flags, and 5. Aftercare and logistics.
All right, let's jump right into section 1, verifying credentials.
Okay, before you even look at those gorgeous facility photos online or read their glowing testimonials, we have to establish the non-negotiable baseline requirements. If a program doesn't pass this phase, they do not get an interview. You're going to see two terms thrown around a lot: licensed and accredited. Now, these are not the same thing. State licensed basically means the facility meets the absolute minimum legal, safety, and operational standards to just keep its doors open. Think of it as having a basic driver's permit. On the flip side, accredited, specifically by independent bodies like the Joint Commission or CARF, signals an extra, totally voluntary commitment to a much higher standard of quality. It's kind of like taking a masterclass in defensive driving. That is what you should be aiming for. The absolutely crucial point here is you need to verify both. Do not just take a slick website's word for it. Actually look for the proof.
Moving on to section 2, matching programs to needs. So, once you've confirmed objective quality and safety, we transition to something highly subjective: the patient's specific individualized needs. Not all programs are the same, and finding the right fit is crucial. The most fundamental thing to check is whether they offer the right ASAM, that's the American Society of Addiction Medicine, level of care. But beyond that standard, you gotta look at the specifics. Do they offer medically supervised detox? If someone's dealing with opioid or alcohol use disorder, do they provide medication-assisted treatment? You'll often hear that called MAT. What about dual diagnosis? Like, can they actually treat co-occurring mental health conditions right alongside the addiction? You also want to look at demographics. Do they specialize in adolescents, pregnant patients, or older adults? And finally, are the therapies they're using actually evidence-based? You want to find a place that checks every single box that applies to your unique situation.
Okay, section 3, essential questions to ask.
Remember, you are the boss here conducting a high-stakes interview, and it is time to ask the hard questions. Your primary test should be this: how do you handle co-occurring mental health conditions? Did you know that over half of people with a substance use disorder also suffer from a co-occurring mental illness? Yeah, it's a huge number. Addiction rarely exists in a vacuum. It's so often intertwined with anxiety, depression, trauma, or other challenges. If you ask a facility this question and they kind of stumble, or if they say they only deal with the addiction part, that is a massive concern. You absolutely need a facility fully equipped to handle complex dual diagnosis situations. So here is your full interrogation checklist. Ask them, what level of care do you provide, and exactly how do you decide when a patient is ready to step down to a lower level? Ask for those specific licenses and accreditations we talked about earlier. Get the details on their medication-assisted treatments. Demand to know what a typical daily schedule actually looks like and what their staff-to-patient ratio is. You definitely don't want a facility where patients are just left alone in front of a TV all day. And crucially, what exactly will insurance cover and what are the out-of-pocket costs? Listen to me carefully on this one. Demand the answers regarding costs and credentials in writing. Always, always in writing. That brings us to section 4, spotting dangerous red flags.
I kind of need to shift the tone here for a moment, because while there are incredible, truly life-saving facilities out there, the treatment industry also has its fair share of bad actors, and we need a stark reality check. If you see a facility guaranteeing a cure, or boasting about wildly high specific success rates, like saying they're 99% cured, literally turn around and walk away. Addiction is a chronic condition. Guarantees of a cure are scientifically impossible and signal a highly unethical, deceptive program.
Then there's the financial side of the red flags. Beware of high-pressure sales tactics that make you feel like you have to sign up right this second. And really watch out for things that sound way too good to be true, like offers to pay for your airfare or waive all of your costs in exchange for using your insurance. This is a classic sign of an illegal and unethical practice known as patient brokering, just disguised as a helpful perk. For instance, if a total stranger on a helpline offers to instantly fly you out to a sunny, out-of-state rehab for free, they are likely brokering you for a kickback. Don't take the bait. Let's just wrap up these red flags quickly. If a facility is reluctant to put their licenses, credentials, or your financial responsibilities in writing, that's a huge warning sign. If they offer this cookie-cutter, one-size-fits-all program with no personalized medical or clinical assessment, that is just not quality care. And if someone clearly needs withdrawal management, but the facility has no medical capability for detox, that is physically dangerous. Trust your gut. Demand personalized evaluation and written proof. All right, on to our final topic, Section 5, planning for aftercare success. Assuming you've navigated the credentials, found a great fit, and dodged the red flags, we have to talk about the long game. Treatment isn't the finish line, it's literally just the beginning of the journey. Logistics and aftercare are what actually sustain recovery. First, let's look at the proximity dilemma. Where should you go? Some people do remarkably better close to home because it allows for robust family involvement and a much easier transition into local aftercare. But others, they absolutely need to be further away to put physical distance between themselves and their daily triggers. There's no universally right answer here, but practicality matters immensely. You have to consider the length of the program, the travel involved for family therapy, and the total cost. A good program that you can actually afford, sustain, and complete is vastly superior to some ideal program across the country that you have to leave early because the money ran out.
And that brings us perfectly to discharge. Recovery absolutely does not end at discharge. Strong, ethical programs plan for what comes next from the very first day you walk through their doors. They should be actively connecting you to outpatient care, setting up medication management, introducing peer support, and maybe arranging recovery housing if it's needed. When you ask them during the interview how they support the transition home, you want a detailed, structured plan. Like we said earlier, a vague answer is a warning sign. So how do we put all of this into motion today? Here is your concrete, immediate action plan. Step 1. Use real-time bed availability resources to quickly narrow down the field of licensed, accredited facilities. Step 2, pick up the phone and call your top choices. Step 3, put that hiring manager hat on and ask those hard questions we just went over. A short, well-prepared conversation is going to tell you a great deal about how a program actually operates behind the scenes.
I want to leave you with this final, vital thought. Recovery is a lifelong journey. It requires a long-term plan, not just a short-term stay in a nice building. So ask yourself, is the facility you are looking at truly prepared to support you for the long haul? Use the tools we've discussed today to find out. And as a final note, remember that this explainer is strictly for educational purposes. Always consult a qualified provider, and if you or someone you know is in immediate crisis, please dial or text 988. Thank you so much for joining me, and stay focused on the path ahead.